Hello to our listeners and welcome to the CardioVisual app. I am Ralph DeFronzo and I am Professor of Medicine at the University of Texas Health Science Center in San Antonio, Texas. And I also serve as Chief of the Diabetes Division. For those of you who don't know my background, and in addition to endocrinology and diabetes, I'm also board certified in nephrology. So today I'm going to wear my nephrology hat. Today we're going to talk about renal outcome trials in type 2 diabetes, implications for therapy. So diabetic kidney disease is a big problem. It's rising worldwide. And from 1997 to 2013, the years of life lost to chronic kidney disease increased by 90% versus a 67% increase in the years of life lost to diabetes. So what does this say? It says if you have diabetes, your lifespan is shortened. But if you have diabetes and you develop diabetes kidney disease, that this shortens your lifespan even more. So now in the U.S. and actually worldwide, diabetic kidney disease has become the leading cause of end-stage renal failure programs, meaning people entering into dialysis and transplant programs. And in the U.S., the cost of the end-stage renal disease program is about $36 billion, and this represents 25%, just think about this, 25% of the entire Medicare budget. And the prevalence of diabetic kidney disease, unlike diabetic retinopathy and some cardiovascular complications, myocardial infarction and stroke, has really failed to decrease over the last 20 to 30 years. So diabetic kidney disease represents a big problem for our patients. It's difficult to treat. The quality of life for our patients is not good when they end up on dialysis, and it's very costly. So we really need to learn how to treat and prevent this disease. Now, this just shows you that we've done a good job in terms of decreasing the incidence of a number of complications that occur in our diabetic patients. So this is a study by Greg, and we're plotting from 1990 to 2010, but I can tell you this trend has continued to 2020. The incidence of acute myocardial infarction, you see it's gone down dramatically. In yellow, stroke in red, parallel the decrease in acute MI. Amputation risk has gone down, but look at orange. End-stage renal disease, diabetic kidney disease has not gone down whatsoever in terms of its prevalence. Now, if you look at people who present with, who have diabetes and present with kidney disease, there's another big problem that goes hand in hand with the kidney disease, and that is atherosclerotic cardiovascular disease. So at the time you see a type 2 diabetic patient, 2/3 of them already have well-established, although it may be subclinical cardiovascular disease. Another 15 to 20% have clinically manifest cardiovascular disease. If you look at mortality, what kills our diabetic patients are cardiovascular complications. And we know that the cardiovascular disease manifests itself some 15 years earlier in people with type 2 diabetes than it does in non-diabetic people. And we've also come to learn now that heart failure is a huge problem, much, much more common in people with type 2 diabetes. And this is really the big problem. When you develop chronic kidney disease and you are type 2 diabetic, your cardiovascular mortality skyrockets. It goes up another 3-fold. So diabetic kidney disease is a huge problem. And then if you develop diabetes kidney disease, almost for sure you're going to have to deal with these cardiovascular complications. So what we're going to plot on the x-axis is the glomerular filtration rate going from the left, greater than 60 ml per minute per 1.73 meters squared, to the right, less than 15 ml per minute. And we're going to look at the rate of cardiovascular events per 1,000 patient years. Now, this is both a diabetic and non-diabetic population, but it really doesn't make any difference. The data here are identical for people with diabetes and non-diabetes. So if your GFR is above 60 ml per minute, your risk for a cardiovascular event is really modest. However, you can see as your GFR drops to less than 60 down to less than 15 ml per minute, the rate goes up some 15 to 20 fold. So when you're dealing with diabetic kidney disease, hand in hand, you need to pay attention to the underlying cardiovascular disease.